Hi, I'm John Deen. I'm on faculty at the University of Minnesota in the swine group, and I welcome you to these ASF Conversations and also to our annual layman conference, where approximately 1,000 veterinarians, producers, and managers come together and discuss a number of various challenges. And especially on our list this time is African swine fever. And so we do a great deal of just-in-time discussion, and I welcome you to this conversation on how we should act as an industry and as producers in the face of these newly identified threats.
Hi, I'm Paul Sundberg. I'm the Executive Director of the Swine Health Information Center. Swine Health Information Center is an organization that was formed in 2015 to work with the National Pork Board, National Pork Producers Council, and the American Association of Swine Veterinarians to try to help prevent, to prepare, and to respond to new and emerging diseases in the U.S.
To begin with, Paul, we'd like you to just describe the role of the Swine Health Information Center and what your aims are, especially in the face of African swine fever.
Well, the Swine Health Information Center was formed in 2015 by a grant from the National Pork Board. And it's really kind of a pilot project. We looked back in history and saw that circovirus came at us and PRRS came at us, and the diseases seemed to come in a cycle. And when we got PED in 2013, then the effort was, why do we keep doing the same thing over and over again? And so that was the formation of the Swine Health Information Center. Let's see if we can do something different and handle emerging diseases differently. And so the center is charged with monitoring, looking over the hill to see what we can see that's coming at us, both domestically and internationally, and preparation, making sure that we have as good a preparation as we can diagnostically and with producers and veterinarians, and then helping with response and recovery in working with the other organizations, National Pork Board, National Pork Producers Council, and American Association of Swine Veterinarians to help with response and make sure that we're doing the best we can for our producers.
You mentioned the swine producing organizations. I'd like to hear how this interacts with the planning that is done by USDA.
With USDA. Well, USDA has the regulatory authority over emerging diseases in the U.S., and there's no doubt about that. And again, we go back to the PED lesson, and USDA in the initial telephone call said that we aren't real sure about our regulatory authority here, but we're going to help you as an industry respond in every way that we can. So we work with USDA and we help them help us, and they do help us. We work together. This international monitoring thing is an example, and the preparedness with the diagnostic labs, the National Animal Health Laboratory Network, and the preparedness that has to come through that. So it is an effort in coordination. I think that's probably the best way to put it. It's not necessarily a hand in glove, but it's a coordination effort and something that we work on all the time.
So added to that then, compared to porcine epidemic diarrhea virus, we've got African swine fever now.
Yeah.
How does that differ in the discussions and the response with the USDA?
So one of the things that with African swine fever that is absolutely critical is preventing the virus from getting here if at all possible. And we, the collective we, the pork industry, we know that we can't do that by ourselves. We have to do that, and USDA has to help us with that because they're the competent veterinary authority, and they look at that national biosecurity. We have control over our farms, but we need USDA's assistance in that national biosecurity and all the things that happen at the borders.
Are there other agencies in the U.S. that need to be involved other than USDA?
The other agencies involved besides USDA include the Department of Homeland Security. They're very important. because under the DHS is the Customs and Border Protection. And those are the folks that are at the ports of entry, and they're the ones that stamp your passport and do the inspections and take a look at what you say that you've been doing out of country and see if that's any risk. Part of their issue is to monitor for risks for agriculture. The Food and Drug Administration also has a play in this because of the feed issues. They have responsibility over feed control because it's a food issue. Animal feed is under the control and authority of the FDA.
An example that's being discussed at this point is sausage casings that are collected in the U.S., processed in China, and then brought back to the U.S. Where does that fit in discussions?
Sausage casings, that whole process of sausages and sausage casings adds at least $2 a head to the worth of a pig. And it's not just the casings, but it's also the shoulders, because that's primarily the meat that goes into the sausages. So there's a whole interaction there of worth. What we've done is asked USDA how they handle that, because they're the ones that do the permitting for that in their import-export section. And what happens is they do not allow any sausage casings from any place that has that's positive for ASF to come into the country, that originate in that area. We send a lot of casings over to China to be processed and then bring them back. Those are actually U.S. sourced, U.S. origin casings. And as they go over in a brine solution that fairly well, probably guarantees that there won't be any contamination going over. They are processed in an area that's been inspected, that is separate from everything else, and then they come back in that brine solution. So while sausage casings are important, and the whole issue of sausage and meat, waste meat, is really important, I think that the sausage casing issue itself is probably answered fairly well in the regulations and the control that USDA has right now.
Okay, so that's one example of a risk that exposes the swine industry. And we're assessing or making a list of risks at this point, whether it be feed, whether it be contaminated clothing, whether it be visitors, whether it be food that perhaps is not detected by our Customs and Border agents. How do we prioritize our efforts in the face of this growing list of potential?
That's really a central question in this issue of prevention, because you want to put the most resources that you can at the higher risk, not neglecting the lower risk items, because again, learning the lessons from PED, there are windows open and we've got to close them. We've got to identify them and we've got to close them. And so the prioritization of those risks is really important. There's a lot of interest right now in feed and feed products. And as we went through the PED outbreak, we saw that with very little question, PED was able to move around the country in feed and feed products. We know that. Certainly there was a lot moved with pigs, and there was movement with people. But there's no doubt it moved with feed as well. When you look at ASF and the opportunity for ASF to come into the country, you also have to put feed in perspective with the other risks. We're in an international economy, and there are people moving back and forth all the time. And this Customs and Border Protection, as they do their inspections, it is absolutely amazing the tons of food and products that they confiscate at those border crossings. And with our experience with ASF, there's little doubt that looking at China and looking at Europe, that food waste, the human food is a very good way to transmit that. So that is a risk. There's no doubt about that. And that is something that we're absolutely focusing on. You go to the rest of them with movement of people, movement of fomites, of things that can move from one country to another. Not just the inside, not, for example, feed is one thing. We import vitamins, amino acids. We even import soybean meal and DDGs from China. And the breadbasket of America, we still import soybean meal from China. And our experiments have shown that ASF is able to transport in those materials in the time that it takes to import them. Now, we're not sure about how much risk that is. That's the issue. Quantifying risk is really important. But if that happens, it is a window. It's a window of opportunity, and we can't ignore it because we want to shut all those windows that we can identify. So we've got to put that in, and work as best we can to try to close that. But at the same time, not let that be a shiny object that we're looking at and then we ignore something else that is slipping behind us.
So here is a tough question, is how can we start assessing those levels of risk?
Yeah, well, that is a tough question, a very tough question, because there's so little data. There's so little real good information. And when you just don't have a lot of good information, you've got to use your best guess, and you've got to work on intuition, and you've got to work together to try to figure things out. I think part of the issue here is that when you put a whole lot of smart people together and talk about things, the real things come out, and you can identify and you can prioritize by consensus of, well, we don't have the data, but we recognize that this can happen. So priority by consensus is really an important thing. Without the data, we really can't quantify. It's really more of a qualitative assessment of what do we think is the most likely thing and where should we put our resources.
I guess the other factor would be how much virus there is in the source country or area.
Yeah.
And what can we do as an industry in the United States to start working with on an international basis to lower that threat?
Yeah, that's really important. I mean, that's an example of really our national policy. Let's fight the wars somewhere else besides here so they don't get here. Let's fight the war of animal disease somewhere else so it doesn't get here. And that makes a lot of sense. I know that there's a lot of challenges with that, with, for example, South America and the EU, Australia, Japan, around that Pacific Rim. There's a lot of cooperation. There's a lot of cooperation and interaction with those folks. With China, it's more of a challenge. And we don't have that open cooperative effort in China. So it's very much more of a challenge. And that's part of the recognition as well of risk, of what can we do if there's anything we can do to help them over there so it doesn't get here. We didn't do that with PED. And we saw PED circulating in China for years before and didn't do anything about it. And again, that's kind of one of the things that we're trying to learn the lesson and not repeat history.
Yes, and sometimes, just as an observation, the U.S. has had more distant relationships with international government organizations like FAO, like OIE, and this seems like an opportunity to create some more cooperation. There's
no doubt the International Organization for Animal Health, the OIE, has to play a role in this. The challenge that they have also is that they don't have regulatory authority. They set standards, and other countries can abide by those standards, or if they deem that their risk is different for whatever reason, somehow, they don't necessarily have to follow those. And so it's a spot where, again, the countries can get together, the chief veterinary officers get together and talk about disease risks and standards of how to act. And that's really important. Again, you reach a consensus and a collaborative atmosphere. And one of the things that's really valuable in that is that our chief veterinary officer has relationships with other countries' chief veterinary officers so they can pick up the phone and talk. And that's really an important thing. but it also has limitations. Those organizations have limitations, but I think they play a role in that international coordination. There's no doubt about that, and international facilitation of communication.
Yeah, very fair. Taking a step forward, we're speaking a great deal about the introduction into the U.S. and being the first case. What should producers be doing to avoid being the second case?
Yeah. In radio interviews, that's one of the first questions. It's a common question. Well, what should producers be doing now? What should we be doing? Well, I'll tell you, nobody wants to be the index case. I've even had that. I've had that expressed. Yes. What do I have to do because I don't want to be the index case? And I think that the answer is always going to come back to whether the index case or the second one. The answer is always going to come back to state animal health officials, the state and federal animal health officials, biosecurity on the farm, and how you act on the farm. One of the very most important things is that producers and veterinarians should no longer, if they did, they should no longer assume that they know what that is. If there's any question at all, I know from my days in practice, which are way in the rearview mirror now, but I know that it still happens, that producers, sometimes you've got a health event and well, I've seen that before, so I'm going to do this because Doc was out here and it worked before, and we've got much less of that now, but we still have it. And one of the most important messages is that producers need to involve a professional. They need to call a veterinarian, and they need to get a good diagnosis every time they have that high morbidity, high mortality, anything that looks high in out of ordinary for their health. And because that sets the chain in motion. The veterinarian, that professional, should be looking at that with an eye of what else can this be, and if there's any question, then the veterinarian is responsible for notifying the state and federal animal health officials. One of the things for producers and for the veterinarians to know is that that's not a bad thing. They're not going to be penalized. They're not going to undergo some restrictions because they've called a state vet. They might have to sit down for a bit and wait for a day or wait for 2 days before they get a diagnosis that is not a foreign animal disease. But there's no penalty for that. So they shouldn't be scared of making that telephone call in that if I do that, then I'm going to have to sit for 2 weeks and my pigs are going to be in trouble, and now what am I going to do? That just doesn't happen, and we've worked really hard with the state and federal folks to ensure that that isn't going to be a problem.
And I would just add, as much as farmers fear being the index case, veterinarians fear being the one that misses the index case.
Boy, that's for sure.
And
exactly.
So we're doing a great deal of training in that area as well. And I would like to emphasize as well, it's not only African swine fever. We have challenges with foot and mouth disease, differentiating from Seneca virus. Classical swine fever often has less signs, or it's milder and can be more easily confused with
other stuff.
Yeah.
One of the things that we really learned a very valuable lesson, I think, from Seneca Valley virus, because it looks like FMD. And when the Seneca Valley outbreak started in the fall of 2015, there was a lot of angst about how do we differentiate this from FMD and how do we act. And one of the issues we had there was that at that point, the state and federal animal health officials did sometimes stop things on the farm for a week before they could get a diagnosis of not FMD. And that was a problem. And that was a problem for the producer. Everybody was on edge because of waiting and also because of the animals, and you have to hold the animals and all of that, all the things that have to happen on the farm. that was a very valuable lesson in how to handle that diagnostic chain of events, if you will. And we've gotten past that. We've learned lessons there about using the state known labs and confirming with Plum Island rather than having everything have to go to Plum Island first. Those types of things, we learned good lessons. And I think that leads into ASF, classical swine fever, all those other things. Producers and veterinarians can't be scared of blowing the whistle when it's appropriate, because it might stop things for a bit, but we've gotten much better in how we handle those situations.
One other area of transmission that's discussed a great deal in Europe is wild boar. And I ask, we don't have wild boar, we have feral pigs in the United States. How is that risk being addressed right now?
Yeah, that's a tough one. That one is really tough. And that goes into Wildlife Services. So now you're from APHIS, you go into USDA and Wildlife Services. And we've always got the issue of trying to decrease the population and manage them. The reality is we're never going to get rid of all of them. It's not going to happen. We might be able to decrease their territory, but we've got to know that we're not going to decrease, we're not going to take them out. So then that is back to how do we act on the farm and what happens. And all of the, looking at all of the opportunities for interaction or contact between feral pigs, whether they be live or whether they be sausage, and our domestic pigs. We're in that with pseudorabies, for example. We have pseudorabies in feral pigs. That's endemic in our feral pig herd, but we eradicated it from the commercial herd. That's an example of a successful management of a disease that we have endemic in those feral pigs, and we're able to manage that interface such that we don't allow it, enable it to get into the commercial herd. Wildlife Services and APHIS, that's an example of our federal folks, our state and federal folks have to help us, and they've done a very good job of doing that.
So Paul, my last question is more of a subjective evaluation of the industry. It seems that the Chinese outbreak, and I'm going to say that I think it's going to continue for some time and may become endemic in China as far as African swine fever is concerned. Why did that capture the imagination of the American swine industry? And to add to it is that we have the imagination now, and yet, for instance, with PDV, I think we've entered into a fatigue and we've gotten used to that disease, and may we become accustomed to this new threat as well?
So there's a couple of questions there. The first one about China and becoming endemic. I absolutely agree with you. Without the ability to have a vaccine or those kinds of interventions, that means that in order to eradicate the disease, you have to isolate it and you have to clean it out from place to place. I don't think we can ever expect that to happen in China. One of the questions I get as well is, well, but what's different about this than classical swine fever and foot and mouth disease? They've had that in China for a long time. Why all the excitement? And I think all the excitement comes from that lack of being able to respond in an animal health manner. You have to shut this down, and that takes a lot of effort. We know that with any of those three, that our international trade is going to stop until we have it under control and until we can eradicate it. Most probably, we're going to have a tougher time eradicating ASF if it gets here, because we don't have the tools that we have with those other diseases. And we've been working on those tools for a long time with CSF and FMD. So we've made progress there. There hasn't been that progress with ASF. And so that, I think, heightens our senses and makes things a little bit different in the ball game, a ball game of being able to respond adequately to to lessen the impact, if you will. So I think it deserves this increased attention that it's getting. That's my opinion, and you said subjective, so I really do believe that. The second one is about fatigue, and we've got to expect that this ASF pressure, and it is a pressure, we're getting external pressure from these countries, now more in Europe as well, but from China, from Europe, from Russia, the international pressure that we are getting on the country as risk to these diseases, it's going to continue. There is no opportunity, there's no prospect for that pressure to decrease. If ASF is endemic in China, as we all expect it will be, it'll also be endemic, it'll move into Southeast Asia. It'll move into the other countries. It's not just going to be China. And that's going to continue the pressure. And so we're under that pressure. This is a long-term deal. It's not like, well, let's do this for a couple of months and then we can take a breath and relax. It's a long-term issue. With PED, I challenge you a bit I don't know that we are under fatigue with PED right now. I think we've learned to manage much better. I have no doubt that 2014, the last of 2014, going into 15, there was fatigue there. I agree with that. I agree because this outbreak kept going on, and we kept seeing the effects on the farm. And boy, that was tiring. So there's fatigue there in when are we going to get this done? And perhaps, oh yeah, I know what that is. We can be a little more complacent about what's going on because we think we know. And that fatigue leads to complacency, and that's not a good thing. With this and with PED, I think that we've got to understand that we're managing diseases as we go, trying to make sure that those windows are as closed as possible long term. That's the real issue here, whether it's pseudorabies, classical swine fever, FMD, or ASF, or the next one to come, the next PED to come. It's a long-term issue because we are really dependent on our industry. Our pork producers do a great job with biosecurity. We've got to have that national biosecurity with USDA, and everybody's got to keep their eye on the ball and keep moving forward with that farm and national biosecurity.
Thank you. Spot on.
Yeah.
Yes.
They're the ones that will stop people with the Beagle Brigade, the dogs that will smell out and sniff the sandwiches.